Hello, I'm Lauren Huberman.
And I'm Christina McLean. Welcome to All Access. Today, we sit down with two occupational therapists and learn more about their career pathways, education, training, and how their work is applied in a variety of different settings that all support people with disabilities.
Dr. Molly Bathje is an assistant professor at DePaul University in the Occupational Therapy program. An occupational therapist for over 25 years, her clinical experience includes providing occupational therapy services in psychiatric, pediatric, and older adult settings, in both staff and leadership roles. Dr. Bathje's research focuses on understanding and addressing health disparities faced by people with disabilities and ensuring future healthcare providers are prepared to meet the needs of this population. Dr. Bathje serves as assistant editor for the Open Journal of Occupational Therapy and as a peer reviewer for several other publications. She is active in the Illinois Occupational Therapy Association, volunteers with organizations supporting people who are unhoused and housing insecure, and is a board member for a social service organization providing services to people with intellectual and developmental disabilities as well as their families. Dr. Clarissa Stanhope is a training officer at the City of Chicago Mayor's Office for People with Disabilities. She received her doctorate in occupational therapy from Rush University, where she completed her doctoral research on disability and tourism as an intern at MOPD. Before returning to MOPD in her current role, she worked in school-based occupational therapy. She focused on social justice through inclusion and created an educational model of disability to guide OT practice in that setting. Claire's passion for disability rights started as an undergraduate at the University of Illinois at Urbana-Champaign, and her non-traditional OT practice at MOPD allows her to continue this work.
Thank you for joining us today, Molly and Claire. We're excited to talk to you a little bit about occupational therapy and the work that you have done through your careers. Molly, can you get us started by explaining to us what occupational therapy is?
Sure. Well, first, thanks for inviting me here today to talk with you and Claire as well. So occupational therapy is a profession that focuses on helping people be able to do the things that they need and want to do in their everyday lives. And we do that through a variety of ways, including focusing on the person's abilities and strengths, the occupations or the things that they want and need to do. So things like being able to cook dinner for your family, get yourself dressed, go to work, those kind of things. And then we also focused on the environment and the things that surround people. And we can do interventions or treatments focused on all three of those areas to help people be able to engage fully in their lives.
That's great. And Claire, I know that occupational therapists can work in a variety of settings. I know that you and Molly both work in different settings. Can you tell us a little bit about the different workplaces that occupational therapists can be in?
Definitely. So one of the really great things about occupational therapy as a profession is that we can work in so many settings with, the same degree. So in a hospital setting, there's oftentimes inpatient rehabilitation. There's also acute care. So that is like if you get admitted to the hospital, an occupational therapist would see you there to make sure that you're safe to go home and able to care for yourself at home. There's also day rehabilitation. And so what that looks like is an individual who needs a little bit more support would go to get therapy. It's more intensive therapy. There's also outpatient, which is going to be like a hand therapist or neurorehabilitation after somebody's maybe been discharged from a hospital after a stroke. There's pediatrics, which is a big part of what occupational therapists do. So there's outpatient and inpatient both, and then also early intervention, which is children ages 0 to 3. Also, in the terms of pediatrics, a lot of OT practitioners also work in schools. And so that is a related service, and that's part of, their IEP plans if they have a disability. And then also, like Molly, occupational therapists can work in academia. So a large portion of occupational therapy practitioners do that as well. And then also in non-traditional settings. So for myself, I'm a non-traditional occupational therapist in that I work at the Mayor's Office for People with Disabilities. That would be more like a community-based OT setting. We've worked with an occupational therapist in Philadelphia who has worked on training people on public transit. And then also, I have a friend who works in the foster care system in St. Louis. So there's really a lot of community-based settings that occupational therapists can work in as well.
Wow. So that's a very wide range of settings and also different groups that you both talked about. And it sounds very interesting. And I would imagine that you collaborate as part of a team, especially if you're providing occupational therapy in that environment, like let's say in a hospital setting or in a rehabilitation setting. I imagine that occupational therapists have like an entire care team, and you might have a different role and someone else might have a different role. So what is that like?
So, yep, we work on teams all the time. So we're working with lots of different types of professionals. So in a hospital setting, we will work alongside physical therapists, speech language pathologists, nursing, physicians, physician assistants, like respiratory therapy, lots of other professions. What makes occupational therapy unique is that we have a holistic viewpoint of our patients. So our training includes not only learning about the physical aspects of the body, we take anatomy courses and things like that, but we also have a grounding in psychology. So we also understand motivation and adjustment to trauma and changes in people's lives that give us this sort of holistic, well-rounded perspective on our clients, and that contributes to that care team.
Molly and Claire, can you talk a little bit about the differences between an occupational therapist practitioner and a physical therapist?
Occupational therapy practitioners really have a holistic perspective on our clients. So we have that training with coursework that includes psychology, and we will focus on the everyday activities that people need to do. So we'll do things more like being able to button up your shirt or, again, cook something for your family, whereas a physical therapist may focus on a little bit more of being able to move into the kitchen or move into the bathroom. The occupational therapist will focus on being able to do the activities that occur within those environments a little bit more specifically. And again, we'll team up. So we often will have the same patient or client. We'll work together to move that client toward their goals.
I just wanted to mention on that, I think there's a big misconception about the difference between PT and OT because it can be really oversimplified into physical therapists focus on big muscles and occupational therapists focus on small muscles. And that's why OT does hand therapy, for example. But what Molly just said there is really the distinction rather than just the muscle groupings.
Mm-hmm. And you both have mentioned how occupational therapists play a large role in helping individuals get back to work. Like, how do you do that? Like, what type of activities would you do to assist someone who may need that kind of support?
I think it depends on the setting that someone's in. So when we're talking about like a hospital setting, we're really focused on helping people be able to do usually just their self-care activities. So get up and do their hygiene, be able to get dressed, which are skills that are needed in order to have a job and be able to go into work. And then in rehab settings, they're going to be focused a little bit more on moving out into the community. So being able to get in and out of the car, use public transportation. We will work on all of those skills. We do something called task analysis, where we break down tasks into smaller tasks and understand all of the little minute details of how to do something. And we work with people toward practicing and repeating those things, setting goals and achieving them, and working toward their goals that way to get back to work. We also do focus on cognition, and we'll work with people around that as well if that's an issue. In mental health settings, which is a setting that I worked in for a long time, we will help people with things like being able to be organized, stay motivated, choose jobs that they are going to enjoy and are going to be something that they're going to feel good about doing and be able to be successful at. So we will help people make choices about how to match their job to their abilities. Other things you want to add, Claire?
I think, too, like we help prepare students for work as well. So like when I was working in a transition program, part of my role as an occupational therapist is to make sure that they have the skills they need to be able to then transition into a work setting or a volunteer setting. Mm-hmm. So it's a lot of the same skill acquisition that Molly was talking about, but it's just a different perspective because it's from students who maybe have never had work and are now transitioning into a workplace. So focusing on like social skills and what to expect. That's where some of those like social stories can be really important to helping them understand like how to interact in a workplace and building up their confidence and interacting with others professionally.
Mm-hmm. Yeah, so just as MOPD, like we work with people who have all kinds of skills, abilities, interests, and identify in all kinds of ways as having different disabilities. It sounds like the same is true in the field of occupational therapy. Like, it sounds like a very wide range. And so I'm just wondering, are either of you like specialists in one particular area, or is there an area that you've identified now that's like very high need that you're interested maybe in going into and learning more about?
So I think for me, one thing we haven't really talked about is that occupational therapists, we traditionally think about them working with people individually, so an individual person, but we also work with groups and populations. And so that means that we can address work through population health as well, which typically means more of a consultative role or an advocacy role. So for me, some of the work that I've done around work and employment has been more around advocacy. So supporting programs like the Mayor's Office for People with Disabilities Career Center to help support your program and the work that you're doing and advocate for people to be able to have access to those services. And occupational therapists can also, consult in those ways. So for me, that's where I see my practice being versus working with individuals per se, because we can work on that level, and I think that there's a need for that.
I see. And what about you, Dr. Stanhope?
Well, this was just sort of making me think a little bit about the OT process that we kind of learn in school, and how part of the value of us working in those spaces is that we can come in and evaluate what the needs are. So we have an intern right now who's studying the psychosocial barriers to employment for people with disabilities at our career center. And I think what's really valuable about having her do that work is she's doing essentially a very large activity analysis and breaking down what skills does somebody need to be able to work, and then interviewing these individuals about okay, what is facilitating them to work, or a barrier to work, or maybe it's just a neutral thing that they've mentioned. And so I think that's really valuable, to be able to come into a space and evaluate what's happening with those individuals, and then being able to then address those directly.
Mm-hmm. Yeah, we've had fun working with Alana, and look forward to hearing more about her research that she's gathered from the Career Center. And speaking of students and interns, Claire, we know that you spent your part of your capstone project with us at MOPD back in 2021. And now you're back with us. What interested you in working at MOPD through your internship and then coming back to us?
So I was fortunate to have Molly be my site mentor and Christina McLean be my, I think I flipped that. Molly was my academic mentor, and then Christina was my site mentor. So I was really fortunate to have a lot of support going into that. And as Molly kind of mentioned, she's worked in population health, and that's sort of the area where she's really specialized. And so it was really helpful for me to have her guidance, because I think that's something that I really value too, is being able to address things a little bit on a larger scale sometimes and seeing it from a different perspective. So I got interested in doing that work because of Molly's story, actually. Molly, could you maybe share about how Morgan's research started at MOPD as the first intern there?
Sure. We're going way back.
Yeah, way back to the first intern at MOPD.
Yes. So I was doing some work around disability and healthcare, and we held a conference at Rush University and invited people from all over the country to come in to be a part of this conference, where we were focused on disability and healthcare. And many of the guests that attended the conference, including our keynote speaker and several other prominent people at the conference, were staying in some local hotels, and they all were people who have disabilities. And things went poorly because they weren't accommodated well or correctly at their hotels. And this was the first time I really understood what people with disabilities deal with when they're traveling and staying in hotels. And the conference went well, and we all worked through that. But after the conference, I felt like there was a need to do something more and rectify the situation and ensure that it wouldn't happen again. And so at the time, Morgan Stasel, who was a student at Rush with me, was working with me, and we held a conference for local hotels about accessibility. And we invited the former commissioner of the Mayor's Office for People with Disabilities, Karen Tamley, to attend that. And Morgan became very interested in these kind of issues and reached out to Karen Tamley and asked if she could do her occupational therapy doctorate capstone at the Mayor's Office. And Karen Tamley graciously agreed, and Morgan was our first student to work at the Mayor's Office. And it was a great experience for Morgan, for me as well as her faculty advisor, and really helped solidify a connection between the Mayor's Office and the OT program. So that's a little of the backstory of how we've first started having occupational therapy interns at the Mayor's Office.
Yeah, and then I think for me personally, like my background was in community health, so I've always been interested in like a public health perspective. And I thought it would be a really good combination of occupational therapy and community health kind of all in one. And so me and another intern, Kim Porsavegan, we were able to come there and kind of continue Morgan's work. So Morgan focused really on the hotel aspect, and Kim focused a lot on the airline travel aspect. And then I was able to focus on the training aspect and how we are training our individuals who work in hospitality to better understand disability. So that got me really interested, and I really valued my experience there. I learned far more than I could have expected to learn, and so I loved that experience, and I think I was really motivated to come back and continue that work because I found it so valuable.
We're glad you did.
Yeah. Me too. It stood out to me as well, Molly, when you said that occupational therapists also work in areas around like mental health. And so that is not something that I would have associated the field of occupational therapy with. So I'm just wondering, like, what does that look like? And what kinds of modifications are in place from an occupational therapy lens?
So my experience is that I worked in inpatient mental health hospital-based units with people with acute psychiatric illness. And so when people are experiencing an acute mental health crisis, they typically aren't able to do things like their daily activities, take care of themselves, get out of bed, get dressed, eat, socialize. And so part of the work that we do is helping people get back into those daily routines and developing or redeveloping habits for that. A lot of the work on inpatient psychiatric units is facilitating groups. So I ran a lot of groups that were about how do you manage your stress? How do you implement a healthy daily routine? How do you communicate how you're feeling to other people? How do you reach out and get help? Working on those types of skills and setting people up so that when they left the hospital, they had built up some skills and some confidence in their ability to do those things so that they could manage their illness outside the hospital.
And I don't know if we've really mentioned it yet, but I know a large part of your work, too, is around data, collecting data, evaluating data. Mm-hmm. And that's something that you've helped us with, Molly, at our Career Center, and I know is a big part of Claire's work here at MOPD. How does that play a role in occupational therapy?
So we want to make sure that the things that we're doing to support and help people are evidence-based. And so research is a big part of that. So developing the evidence around our interventions, around our treatments is important. So we need to know how to set up a research project and collect the data and then analyze the data and then interpret the data and come to conclusions about it. So part of our training does include understanding how to conduct research, but also how to consume research so that as a practitioner, when we're thinking about doing a certain intervention, we can go to the evidence, which often includes research, and look at that and make sure that what we're doing is sound. And it also helps us establish the value and the benefit of our profession when we're sort of measuring what we're doing.
So we like to also ask our guests about their professions and how they chose their professions and what they love about it. So just as a starting point, why did each of you decide to go into the field of occupational therapy, and how would somebody else with similar interests go into that field?
So this is a question that also gets asked of occupational therapists a lot, is like, why OT? Like, that's the question. Why did you choose occupational therapy? And so this is a great question. I've written many essays on this. I think there are like two answers to this. The first thing that really inspired me to get into occupational therapy was part of my sorority's philanthropy was arthritis. And so I went to their conference as a freshman in college. And we had a speaker who had childhood juvenile arthritis, and she spoke about her experience with arthritis and how that impacted her. And she was talking a lot about some of those activities of daily living that Molly was talking about earlier, about those things that were really meaningful and purposeful to her, and how arthritis was impacting her ability to participate in those. So, for example, she talked about like how it was limiting her ability to take the Thanksgiving turkey out of the oven, or her ability to walk her daughter down the aisle. Like these moments that were really purposeful and meaningful to her, she felt limited in. And I think that was a privilege for me, that I hadn't thought about that before, and I hadn't thought about functional limitations that people experience. And so that was sort of when I was inspired to look into occupational therapy as a profession and a career for myself. But the second part of that actually is once I got into occupational therapy, and I know Molly knows this because I've told her several times, but she really encouraged me to continue in occupational therapy because it's kind of who you are as a person. Like when you meet an occupational therapist, we tend to have very similar qualities. We're typically very social people. We love problem solving, but also being creative. There are a lot of similar qualities amongst a lot of different occupational therapists. And my first year in school, I was kind of considering whether occupational therapy was right for me because it's a really challenging coursework to go through. And I had gone into Molly's office. She was my academic advisor. And I was like, I don't know if I want to continue with this. This is really challenging for me. And she's like, okay, you like no judgment. Truly, she had no judgment. But she's like, I just want to tell you a little bit of a story about my own experience. And she told me, I hope you don't mind me telling your story for you.
I don't know what story you're going to tell.
But she told me, like that she had those doubts before too, and that you had stopped being an occupational therapist for a bit of time, right? You went into, was it computer training or?
It was training on the electronic health record, teaching people how to use it.
Yeah. And so she had told me how she had like stopped being an occupational therapist for a bit because she was feeling similarly to how I was feeling, but that when she was in that role, she was literally just being an occupational therapist just differently. Like it wasn't her title, but she was doing the exact same thing and using the same skills. And that typically it's just like kind of who you are. You are an occupational therapist. It's part of you. And I really feel that about myself. And I think a lot of OTs do. And I think that's also why if somebody asks you like, well, what do you do for work? You say, I am an occupational therapist. There's no way to be like, oh, I do occupational therapy. It's like I am an occupational therapist. So I think it's like a really strong identity that we hold.
So for me, I became interested in occupational therapy when I was in high school, looking into colleges and what kind of major I wanted to go into. I came across occupational therapy because I was really interested in doing something in psychology. And again, occupational therapy has a lot of coursework related to psychology. And I knew that I would be able to work in mental health settings, and that was my ultimate goal. So when I was in school, an occupational therapy degree was a bachelor's level degree. Nowadays, to become an occupational therapist, you need to have either a master's or a doctorate degree. So the thing is that you have to graduate from an academic program that's accredited by our national accrediting agency, and they accredit programs at both a master's level and a doctorate level to become an occupational therapist. So you need to graduate from one of those programs, and then you have to pass the test. There's a national board certification exam. It's 4 hours long. Claire took it much more recent than I have, but it's a 4-hour long exam that everybody has to pass. And then you get licensed in your respective state, wherever you want to practice. There is also another degree level for occupational therapy, and it's occupational therapy assistants. Those are people with an associate's degree, and similarly, their programs are accredited by our national accrediting agency, and they also take a certification exam as well. And often occupational therapists and occupational therapy assistants work on teams together.
April is Occupational Therapy Awareness Month. How is that typically celebrated? And that's why we're here today as well, to recognize the profession and both of you. What other types of things happen to celebrate?
So one of the big things is typically our national conference is held in April, although this year it's in March, and it brings together occupational therapy practitioners from across the nation, and they get together, and it's like a big pep rally in a lot of ways, but also a lot of educational offerings and networking and things like that. And that's really a big celebration of occupational therapy. We also, a lot of times at people's workplaces, they'll just have some kind of recognition event of occupational therapy. It's a way to promote the profession and talk about who we are, and also to take a moment to reflect on what we do and celebrate that in ourselves.
Is the field of occupational therapy similar to the field of medicine, where there are primary care shortages currently and anticipated to get worse as time goes on? And do you try to lift up the profession in that way as well?
Mm-hmm. So one of the things about Occupational Therapy Month is, again, talking about it. A lot of people don't know what occupational therapy is, and so opportunities like this are great to promote the profession that way. I just read recently that the job growth predicted between 2022 and 2032, I think, is 11%. So the career outlook continues to grow. The job outlook is strong. Also, occupational therapy was just recognized by U.S. News and World Report as the number 4 most top-rated health profession. Oh. So that's a nice distinction as well. So it is a strong field to go into. It's growing. It ebbs and flows. It's kind of like nursing that way. It ebbs and flows in terms of shortages and surplus, but we've been steadily growing over the last 20 years, I would say.
Yeah, I think if you look at trends too, population trends, the United States has a big aging population that increases the need for occupational therapy practitioners. Or also there are more kids that are diagnosed with autism and intellectual and developmental disabilities. That also increases the need. There's a really big need for occupational therapists, I think, as well.
It's interesting that the field of occupational therapy is so highly ranked in terms of other healthcare professions. What do you think the distinct value is among occupational therapists, practitioners, and other healthcare professions?
So Molly had mentioned earlier that we're a really holistic profession, but another really distinct piece of that is that we get a lot of training about disability as occupational therapy practitioners, and I think that's really unique in the healthcare field. For example, physicians don't always get training on disability, and sometimes at all. So there's some research out there that shows some physicians don't receive any training specifically on disability as part of their training. And a lot of times they practice with a very medical model of disability. So that's sort of focusing on fixing the disability. Whereas occupational therapy practitioners, we receive a lot of training about disability. Depending on where you went to school, you might have also received a lot of training about disability culture and interacting with people with disabilities. And I think that as a healthcare professional, to have a lot of experience with interacting with people with disabilities and knowing how to address their unique health needs, I think that's really a valuable piece of occupational therapy.
I agree. Some of the other work that I do is around addressing health disparities for people with disabilities, in particular people with intellectual and developmental disabilities. And the research really shows that they are a population that is a health disparity population. So just recently, the National Institute of Health recognized people with disabilities as a population that faces disparities, which is a big deal because it means then that there'll be funding that can be allocated toward research and programs to address that with people. But up until this point, we haven't done that. There's a lot of reasons why people with disabilities face disparities, and one of the bigger ones is preparation of health professionals related to disability. The work has been slow. It's also, something that people with disabilities have been the leaders of, and that's important. So we also need to be hiring people with disabilities into healthcare, and they need to be welcomed into health professions trainings programs. So becoming nurses, becoming occupational therapists, physical therapists, physicians. The representation is also really important to, again, addressing the disparities in the outcomes.
All right. Well, thank you for joining us today. It's been great to hear about occupational therapy as a profession and to have both of your insights and experience shared here today.
Thanks so much for having us, and I was really happy to be here and have this conversation and appreciate you hosting us and love working with you.
Yes.
Yeah, thanks for having us. We're thankful for our allies of occupational therapy.
Absolutely. Thank you.
Thanks for tuning in to this month's episode of All Access. Be sure to follow us on social media at MOPD Chicago.
Special thanks to our executive producer, Commissioner Rachel Arfa, as well as our ASL interpreters. And a huge thank you to the City of Chicago production team and our special guests for today.